Welcome everyone. It's Glenn Reeves here providing another brief update on the impact of COVID-19, particularly on our patients with autoimmune diseases. I've received some very disappointing and frustrating news from patients, feedback about them having to ration and ultimately discontinue their Plaquenil. But I've been encouraged that this hiatus seems to be passing, largely with the professional and strong efforts of pharmacy professional colleagues, who've been prepared to ring around and to ask for alternative generic brands. Now, there is some concern about the use of generics. There is a thing called Hequinol, for example, which is, as far as we know, identical to Plaquenil. Remember that all of these agents have to go through a strict quality control process, and that really the only thing that often differentiates them from Plaquenil, the main brand, is one, that they're less costly because the trademark issue is no longer there. And secondly, there may be different excipients, so different things holding the material together. But we believe that these agents are equally effective, and we're pleased to hear that the problems with the stocks are gradually being overcome. So I'd like to commend those of you who've been through pain and through anxiety, some of you who've had to stop your medication and increase prednisone accordingly. I'd like to commend you and say that that is now, I believe, almost past us. So indeed, some studies on the use of Plaquenil have suggested that the combination of Plaquenil or any related form of hydroxychloroquine and the use of and the development of COVID actually has an adverse effect on the heart. And so, given that COVID is not just a respiratory problem, it can affect other organs, including the heart, that's extra reason not to go using an agent which has been demonstrated in studies not to be effective. If anything, in some studies, the rate of mortality has been higher in people given Plaquenil. That doesn't mean that Plaquenil is a dangerous drug. It offers great value to those people with appropriate indications, but it is by no means a panacea. And we're glad that the world has learnt to perhaps temper their enthusiasm for the messages of the leader of the free world, and I trust that none of you are injecting bleach into your vessels either. Remember that we are approaching World Lupus Day, which is May the 2nd, and so we are even more grateful that this distraction, created in a somewhat mischievous way, is behind us. Meanwhile, the world continues to watch COVID case numbers with concern, particularly in rapidly growing areas such as the African states, the United States, the United Kingdom, and parts of Eastern Europe. In contrast, Australia is holding its own. Our curve seems to be turning a corner, although it's no time for complacency. At the Johns Hopkins site for recording cases, we have 6,700 cases confirmed, and sadly 80 individuals have passed away. But with our application of social distancing, careful hygiene, case isolation and contact tracing, we are turning a corner. There is concern, of course, because we have hit the brakes pretty hard, and it's argued whether we can sustain this degree of isolation and still remain functional and indeed sane as a society. So at some stage there will be talk about easing off on the rigour of the restriction measures, and many authorities are arguing for more extreme and more extensive testing so that we can get a better idea of what we are actually dealing with, because we don't really know, for example, what are the true infection rates, what percentage of people are actually immune, what's the duration of the immunity in those who have been infected, what are the problems with non-pulmonary complications. We know that there have been reports of anosmia, which seems to be quite specific for this condition, although of course it'll happen in any condition where you get a clogged up respiratory upper airway passage, but anosmia, and also the presence of particular spots over the feet have been reported as important non-pulmonary symptoms. Unless we actually look at the prevalence of COVID, and serology has been put forward as a potentially useful approach, we don't really know how many of these other unusual complications might exist. It's been mentioned, for example, that clotting rates are increased, and certainly the markers of clotting are increased in the infected individuals. We don't really know what the rate of silent transmission by our dear children is, and we don't really know the true efficacy of public health measures. So for the privacy-minded of us, and I think we're all concerned about the use of public apps which have internet access and describe our symptoms in a broad way so that public health tracking can occur, despite our reservations, I believe that a well-designed, secure system to allow a better idea of the distribution of these conditions would be worthwhile. So meanwhile, well done to the vast majority of you who are staying the course. Our telemedicine services through Coastal Immunology and through health networks throughout Australia and the world are delivering ongoing care. And next week, I wish to speak more about the immunology of COVID. But in the meantime, take care and keep safe. Keep the faith.